federal health care program that helps first responders and others sickened from toxic debris on September 11th is facing staffing cuts. The latest development comes as the Trump White House slashes the federal government. Washington reporter Kevin Fry has more.
Harvey Gardner was 35 years old and working in the North Tower when two planes crashed into the World Trade Center on that clear September morning. In the years since, his younger brother Anthony has sought to preserve Harvey's memory. First, by working for the 9/11 Memorial Museum and the Victim Compensation Fund, and most recently at the World Trade Center Health Program.
I want to just make him proud, and that's why I've spent the last couple of decades trying to honor him.
But that work abruptly ended on Saturday when Anthony, along with some of his colleagues, received a termination notice. Part of what advocates say amounts to a 20% staffing reduction at the program, which offers medical monitoring and treatment as 9/11 first responders and others exposed to toxic debris and smoke navigate lingering health effects and cancer. That reduction reportedly coming from a combination of layoffs and buyouts.
The program was already bare bones. We are already short-staffed to do the vital work that we do every day to care for our members and to get new members enrolled.
The move has sent shockwaves through the 9/11 community, with advocates warning it will undermine efforts to help patients and certify their ability to receive treatment.
There was always a backlog, but it was getting better. And now it's going to create a bigger backlog. We're talking about people sick and dying that are going to get sicker and die.
New York's two Democratic U.S. senators slammed the staffing reduction, writing, quote, "The Trump administration must come clean with whatever dirty deal they have planned for a health fund that should be about taking care of our 9/11 heroes. Nothing more, nothing less." Long Island Republican Congressman Andrew Garbarino wrote, "I have emphasized to the White House how critical this program is and will continue advocating for the support it requires." The staffing reduction comes just months after the World Trade Center Health Program faced another blow. A plan to provide long-term federal funding was included in an early draft of a must-pass government spending bill in December. But that bill was torpedoed by then-President-elect Donald Trump and Elon Musk, and the provision stripped from the legislation that ultimately passed. We did reach out to the Trump administration about the staffing reductions. As of deadline, they did not respond to a request for comment. In Washington, Kevin Fry, Spectrum News.